Good morning. This is Steve Stites broadcasting live with you. Wait a minute. No, I'm not in the Dahl Simons Family Studio. But in the Dahl Simons Family Studio are my good friends Dana Hawkinson and David Wild. We're going to turn to that in just a moment. I'm broadcasting live from my home. Today's actually a day off. I'm supposed to be doing a little board review, do some personal errands. Who knew that only certain businesses are open on Monday to Friday? But you know what? There's a lot going on, and it starts right here at KU. Because this morning's numbers are not good. And I wanted to make sure I was with you today so we could have a discussion about the importance of what's going on around the coronavirus crisis and also what we need to do about it. Let's turn first to Hawkeye. Hawk, not good.
It's not good. I think we were a little bit happy, although we always have said that there's going to be vacillation in these numbers, but we were kind of happy on Friday when it went down to 65 acute inpatients. Unfortunately, over the weekend, we've had a pretty significant increase. We have 80 total acute infections right now, 31 of those in the ICU and 11 are on the vent. We still have 45 in the hospital for that recovery period, so it's about 130 patients that are here because of COVID originally. Unfortunately, our partners out west have had a huge increase in a surge in their number of patients as well. Hayes has 27 total patients, 24 of which are active infection, and 3 of those are in that recovery phase, but they do have 3 on the ventilator as well. So everywhere is seeing an increase in the number of acute COVID patients.
Well, that's exactly as it looked like it was going to be last week when we were looking at that exponential rise in Kansas City. David, you're our Vice President of Performance Improvement. You're great with all this information. Talk to us about where you see things right now and where we're headed, because it doesn't look good right now.
Yeah, it sure doesn't, Steve. So we'll actually start with some pictures, I think, because that helps tell the story. So first, start out at the big picture, the national level. We've continued to talk about the story that as cases increase, so do hospitalizations. So the average number of new cases per day, the 7-day average is the red line here, and you see it's at the highest point it's ever been, and that line, the slope of that line is steep and up. While nationally it might not be exponential, I'd say it's still parabolic. In most cases, it's definitely steep and not showing any signs of trending down. And the blue line is the number of patients in the hospital, the average number of patients in a hospital in a 7-day period. And so you can see as well that number has peaked higher than it's been at any point in the pandemic, including in March or April. And while those are national numbers and good for the big picture, we've been talking a lot about what's happening in our hospital, what's been happening in the region, what's been happening in the Midwest or the Metro. And so we'll walk through a little bit of that here to set the stage for the conversation about what we're seeing that I think all of us would agree we have to start to describe as concerning. So the next slide is the familiar look for many of you at the Midwest, or actually all regions, but the Midwest being the most important point here. So if you remember, again, these are population adjusted numbers, so the average number of new cases per day per million people in the 4 census regions. And the Midwest is sort of the central and upper Midwest. It doesn't include, say, Texas and Arkansas, because I know we've had questions about that before. But on a population adjusted basis, the Midwest is averaging 861 new cases per million people per day right now. And this is with data through last night. So you can see that number has continued to climb. The slope of that line is, I'm afraid, truly exponential. And remember, we talked a lot about this early on. The peak, say, of cases in New York in the Northeast back in March was 317 new cases per day per million people. So we've more than doubled that. We're working on tripling it, actually, and the line continues to look that way. The other important part about all of these graphs, the slope of each of the curves in every region, is that you can see they are all increasing, and all increasing fairly rapidly. And that is what's driving the national look that we just looked at. So while the Midwest has been the area of most concern for several weeks now and continues to definitely be leading in a race that you don't want to be out front, there's concern really across the entire nation today. If we then move to the next slide, looking at some state pictures. So I just have states here for comparison. We can talk about all of them or why they're all here in just a second. But for reference, the red line on the left-hand side is the same number of population-adjusted new cases that we were just looking at a regional level, but broken down into Texas on the far left, Missouri, Kansas, and North Dakota. On the right-hand side, the blue curves are population-adjusted hospitalizations, so the number of hospitalized patients per million in each of the same states, Texas, Missouri, Kansas, and North Dakota from left to right. So if we start on the cases side, you can see, if we just start with maybe Missouri and Kansas, you can see Missouri has been trending up for a while, but the Kansas increase in the past several days, that line is nearly vertical. And that's what we're feeling in many of our hospitals across the state of Kansas today. You see North Dakota. North Dakota is constantly used as a benchmark over the past few weeks because it has been the state that has been leading, without a doubt, this number of new cases per million, this population-adjusted growth of cases. So the solid red line, again, is the 7-day average. The actual sort of red bars behind it are the number of cases reported in that given day. And so you can see what has happened in Kansas. The actual number of cases have increased dramatically, which is what's driving that 7-day average. But the number of new cases has increased faster even than that 7-day average is showing. I wanted to make sure that we use Texas as a point of reference here, because I know we've talked a little bit about El Paso over the past week or so as sort of a reference point, and that we are concerned that we look a little bit like El Paso. At the state level, you don't actually see the same sort of picture. We're definitely in a different place now, at least on new cases per million. If you flip, though, then to the blue charts, to the number hospitalized, you can see Missouri and Kansas really giving a run, anywhere in the country, a run for their money right now as far as the number of hospitalized patients per million. In fact, Missouri being worse than Texas now, Kansas being worse than Texas now as a state. And I think that's definitely a symptom of that rapid increase in new cases that we've seen. So as we've always talked about, while there may be a delay of several days from an increase in new cases to an increase in the number of patients in the hospital, that pattern, no doubt, is true. We expect it here with no decrease in the number of new cases per day seen over the past few days. We really expect the next 7 to 10 to 14 days are actually going to be much, much worse on the hospitalization front. And I know that that's really intended to be the majority of our conversation today. So hopefully that tees up what we're seeing in the data, gives us a platform really to talk about what comes next. I think, for me, this is gonna sound a little scary, but all of the things that those of us who are interested in modeling and numbers and talking about what happens in the health of a population, all of the things that we were worried that could be possible in March, April, and May are actually happening right now. And that should be very scary for all of us. So, Steve, I'll turn it back over to you.
Thank you. And by the way, you look really good in a white coat, David. I'm impressed.
Someone keeps pressuring me about that.
Who could that be? Who could that be?
Yeah. I don't know. I'm not sure.
So the numbers are scary, and it comes on the heels of a difficult week last week. You start thinking, gosh, we've already had the delay surgeries. We know that last Friday, St. Luke's announced that they were delaying some surgeries. So it puts things into perspective, because we're starting to have to ration care from one group of patients to another group of patients. And without the slope of that curve, it makes you really think that more trouble is coming our way. All on the heels of some really good news coming out around Pfizer, and now Moderna is talking about their vaccine, 95% effective. Really, they actually put a few more numbers out there to give you a little bit more sense of what happened in their study than did Pfizer. So that's all really good stuff, but we're still months away from widespread use of it. We may have some vaccine here by the middle to end of December, but nowhere near enough. There was nowhere to come close to trying to stem this rise. The only thing that's going to stem this rise is what each of us does if we follow the pillars of infection control. It all comes down to that. But the things we're seeing, we're actually just a step behind what's going on in Wichita. Our good friend and colleague, Dr. Gerald Mims, is Dean of the School of Medicine for the University of Kansas at Wichita, is down. And he's also got a large role in public health. And you've got a sink behind you. You've got like a whole place to do good infection control behind you, Gerald. Talk to us a little bit about what's going on in Wichita and how are things there, and where are you guys on the curve right now?
Well, we're in a similar situation as you are. I don't know how it compares number to number, but our cases are way up. Our percent positive on testing is up to 24%, where we were 5.3% back in early September. So it's just gone up like the curve has shown. Our hospitalizations are at their peak. They're essentially close to where you're at right now. Both systems in Wichita are bumping around 100, 110 cases. I haven't heard this week's numbers, but that's where they were last week. So it's very similar across the state. And in the metro areas, it's very similar. So we issued a new order last week. Obviously, haven't had time to see what the effect is. But I think there's a lot of chatter in town about should the order be more restrictive, should it be less restrictive. It's the typical battle we're having everywhere. Still, a lot of people, unfortunately, a lot of people just don't accept this is real. There's still mediocre compliance with the mask mandate. We did implement with the new order a potential penalties for not wearing a mask, primarily on the businesses. So we've asked the businesses, retail businesses, restaurants, others, to take responsibility to enforce the mask mandate in their premises. And there is potential penalties if they don't do that. But of course, there's no one going out and checking. It's just not practical to go out and check. So that's kind of where we're at. We're struggling with what the next intervention will be if we don't get control of the numbers.
And Gail, remind me, you're like the doctor's doctor in Wichita. I mean, you're a general medicine doctor, but aren't you also an infectious disease physician by training?
Yes, I've boarded in infectious disease and internal medicine.
So you've got a great perspective about this, you and Hawkeye. As you look back at your career, have you ever confronted anything like this?
Nothing on this scale. We've had some little outbreaks of other things, but nothing on this population-wide scale. This is unprecedented.
Well, I know you've done great work in Wichita. How is this affecting the hospitals, especially Wesley and Via Christi?
I think both hospitals have decided to move as many surgeries as they could to their second campus. Both hospitals have a second campus. At their main campus at St. Francis and Wesley Medical Center, I think they're trying to reduce the number of surgeries at those sites and trying to move those surgeries to the other sites where they're tending to keep all the COVID patients at their two main large sites. But I think they're on the verge of asking the question, should they just stop doing elective surgeries? Haven't decided that yet, though.
Yeah, that's a tough road to cross. And what are you hearing about? I mean, you heard our numbers in Hayes. What are you hearing throughout Kansas and even south of you in Oklahoma or Texas?
Same kind of problems. And as a matter of fact, the two hospitals here have had to cut off referrals from Oklahoma. They were getting quite a few referrals from northern Oklahoma with people who needed ICU care and they did not have capabilities or room in Oklahoma. But Wesley announced last week they can't take any more. They're being flooded with just our local numbers. So I think it's the way all over state. I've gotten calls from physicians in rural Kansas frustrated that if they have an ICU potential patient with any condition, COVID or non-COVID, needing abdominal surgery acutely or whatever, they're having to make 8 or 9 or 10 calls through all the second and tertiary hospitals in this region, seeing if they can find a bed. And it's very frustrating for the rural docs.
Yeah, but it's only going to get worse. And the problem is that until there's better compliance with the rules of infection control, it's just not going to get better. And I think, it's hard. You sit here in the medical profession and you think, come on, folks, you got to get this. But people are really resisting the basics still, aren't they?
Yeah, and let's face it, they've had mixed messages. We don't need to go into that in any detail, but I can see where some people are confused and don't know who to believe.
Yeah, I think all leaders everywhere just need to get on board and follow the same things. I've been trying to catch up with Dr. Mins for years. He does such a great job. Unfortunately, I'm afraid that what I'm really catching up to him on is the forehead visibility ratio as some things begin to depart. And Gerald, I think you're still ahead of me, but I'm gaining ground, man.
Well, Steve, I was waiting for you to say something about that. I was glad when you asked me about if I'd ever seen anything like this. You didn't allude to the 1918 flu, since I wasn't.
Listen, there are some secrets we have to protect, Gerald. And the School of Medicine in Wichita, how's the school doing?
We're hanging in there. As you know, just like in Kansas City, we had to shut down the clinical clerkships in the end of third year, but fortunately our hospitals have sufficient protective equipment and they don't see any problem with our learners being there. So we're very grateful that we're continuing to have our learners proceeding along their pathway to finishing their third year. We've tried to put everybody who can go home at the office. So the offices are pretty unoccupied right now, but we're getting the job done and trying to keep people safe.
All right. Well, thank you. And thanks for joining the program today. Let's turn and see, Jill, if there are questions from reporters this morning. I know that Cody was on earlier.
Yeah. Hey, Cody. It's Cody with Channel 9 again.
Good morning.
Good morning. You mentioned Moderna already, so we'll skip that one. But we talk about, and what Dr. Min said was pretty striking, that a lot of people don't accept that this is real, and we're still these 8 months into this thing locally. These new restrictions that we're seeing going into place in our area, I know Johnson County has some in effect today. Kansas City Mayor Quentin Lucas is going to speak in about 4 hours, I believe, to talk about other steps. Do they go far enough as medical professionals? What would you like to see happen?
We'll all take a crack at that because that's a great question. I will tell you that the seriousness of this crisis and where we are on the curves that David presented and where the hospitalization numbers are and the rapid increase, I think we have to get real serious about this. And I think that some of the orders may not be, from just a pure public health standpoint, may not quite be enough. Because if we're not going to get people to follow the rules of infection control, then I think we're really going to struggle as a community to take care of patients, both with COVID and without COVID. I'm not saying you have to shut down businesses. That's a public health, and that's an elected question. But I think unless we get really serious about that and not have many exceptions around masking and personal behavior, then I think we will struggle as a community to take care of people who are ill. And again, that's with or without COVID. If you have a heart attack and there's no hospital bed, it doesn't matter that you don't have COVID. It matters there's no bed because we're overwhelmed by the degree and the burden of disease that we have. Hawkeye, what are your thoughts?
Yep. I'm really thinking it's not as much as sitting in the restaurant, and some of those restrictions have come into play now where no in-person dining, whether it's here or New York or Chicago. I think it really boils down to the individual behavior. And it is getting together with a group of 5 or 6 friends and having a get-together in your house or taking a small trip with those 5 or 6 friends. You may have just your bubble, which you think it's just them, but they have bubbles as well. And so I think it's really the individual behavior that we can't really we can't force any change upon. It has to be everybody understanding and recognizing that I can't get together with these 5 or 6 friends in my house or go on a trip with them right now. Maybe in a month, maybe if we can help decrease the spread of this infection. But right now, I think it's more of the spread in that way at private homes and get-togethers, other things in which people are getting together that they are just mixing bubbles and don't really understand that, hey, this person could be sick, and then 2 or 3 days later you find out this person was sick and now we are all exposed. So I think it goes down to more of the individual behavior in that kind of sense.
Yeah. What are your thoughts, David?
Well, I think I would start by agreeing with you, Steve, that we really have to impress upon the community how serious we all need to take this. We are at a point where the behaviors of each individual person are going to make a difference. And I think for me, as we answer a question about do certain restrictions or interventions go far enough, I think I always come back to we can't have a rule that will address every situation. And what we really need is each and every member in the community to really understand that what they do is the important part of the conversation here. To Dana's point, this is about the behavior that we're seeing, not necessarily about is the rule strict enough or not strict enough. And so steps that make it apparent how serious this is, public health orders that do those things, I think are helpful. But I'd really answer that with a really, really almost passionate beg of each and every member in the community to really understand that what we're doing in our own lives at our individual levels with our families and mixing bubbles, to Dana's point, is what's driving this. And so I agree, we don't need to shut down every business in the community to manage this, but we are going to have to make some sacrifices, and I think it starts with each of us.
Yeah, I think that's exactly right. And, you know, I looked at the Johnson County rules. There are so many exceptions to it. I'm not sure how they could really get that done, how they could accomplish it. And so it's going to require personal responsibility to do it. Because the next step will be a shutdown. If this doesn't work and the healthcare resources get as overwhelmed as we're fearful that they're going to, we will not have a lot of choices, I'm afraid. And the part that's so darn hard to me is that, and I know people are tired of this pandemic, and we all have COVID weariness syndrome, but I think that we're on the cusp of really having some effective stuff. I mean, today, I think we'll be giving our first doses of monoclonal antibody to patients in the outpatient setting who are at high risk for a bad outcome with COVID-19. I mean, that's remarkable. The two vaccines, both Pfizer's and Moderna's look really good. We haven't seen all the data, but wow, I think that's remarkable. And I think, we're just a few months away from being in a far, far, far better position. It's like, you got first and goal, the goal line, you're going to win the game. Don't fumble the ball. Don't lose the game. And it's all up to us to not lose the game. And there's no blame to be put on this. It's all about our own personal behavior. And if we choose not to be responsible, if we went back to the preamble of the Constitution last week, if we do not secure the blessings of liberty ourselves and our posterity by acting irresponsibly, there's just so much tragedy that can await us that we can avoid. And you know what? Yeah, it's a pain in the rear, and it's a pain that we've been having to do it all those months. But that's what happens in a pandemic. When mankind has faced this pandemics, whether it's in 1918 or the bubonic plague or any other pandemic, if we work together, we can get through it together. If we decide we're each our own individual agent and we can do anything we darn well please, then we will suffer the consequences of that decision. And the consequences of the decision are very real. It's not influenza with a vaccine and with Tamiflu. It's actually much worse, and it's very real, and it can be very, very painful to all of us if we lose people or have people who have permanent lung damage or heart damage because we didn't exercise the rules of infection control. We can do this, we can master it, we can bend the curve, we can beat it, and we can be safe and get back to a more normal life as these new therapies come on board over the next few months. We're almost there. Don't fumble the ball at the goal line. Gerald, other thoughts that you have about this? And I know the rules in Wichita are more restrictive than ones so far being proposed here in the Kansas City Metro.
While you were talking, I just got the text on the case here in Wichita. One of our health systems has 122 patients in the hospital with 36 in the ICU. The other system has 108 total with 51 in the ICU. So as I said earlier, similar to what you were saying at your hospital, but the ERs, just got a text saying the ERs are sitting down there with COVID positive patients just sitting in there on gurneys waiting for a room to open up. So it is getting to the crisis. I hate to use that word, but it's getting to the crisis level. And you're exactly right. Our success is based on enough people taking responsibility to get this thing back under control.
Yeah, this is like an F7 tornado here. We're at the bad point. Gerald, for a while they were talking about building tents in Wichita and getting to the point that we were seeing photos from El Paso and other parts of the country where it's been overwhelming. Is that true, false? Where are things there?
I think discussions have been going on. We've been seeing the case numbers double every 2 weeks here in Wichita for the last number of weeks. And I think people are saying, where is the ceiling? If the ceiling keeps expanding like it has been the last 4 weeks, we do not have enough staff or people in the hospitals to take care of it. So at least discussions are going on about, okay, what empty building are we going to open up if the things don't stabilize? We're not saying they won't, but we want to be prepared. We are also looking into where we could bring in traveling healthcare workers to help staff those areas. Obviously, that's not easy right now because a lot of places are looking for temp help. So at least discussions are going on. There are no tents being erected today. There's no open real estate being converted to field hospitals today, but it's certainly being talked about and the contingency plans are being developed.
Yeah, I think we are going to have to do that, and I think we're at such a dangerous point on those curves. Let's see if there's another question from reporters.
Hey, good morning, guys. It's Taylor Hemness at Channel 41.
Hey, Taylor.
A couple of questions, actually. One that my colleague Lindsay Shively asked this morning. She and I were talking about the Moderna trial, and we were curious about what happens with you, because we heard about Pfizer last week. What's the protocol when there are multiple potential vaccines that work? Like, should we expect that every American is going to be getting the same vaccine once they're approved, or one's going to get this one, one's going to get this one? Should it matter? That's the first question. And then the second question is about sports leagues starting up. Obviously, basketball season starting up. I just did a story on it this morning about those being in effect. And just your comment on whether or not those should be allowed to go forward. They told me they worked with Johnson County Health Department to get the best rules in place as possible, but it still feels like, is this the right thing or not? So just your thoughts on whether or not those should even be allowed by local counties.
You bet. Well, I think that we had a large press conference on Friday. We addressed a lot of some of that, but I think things have changed over the weekend because the curves continue to worsen and the hospital census continues to worsen. So let's come back to that in just a moment, but we'll start with the distribution of the vaccine. Because I think that's a great question. And honestly, I'm not sure anybody really knows the answer to that question, Cody. So let me ask first, David, you've been involved with some of the planning, you and Hawkeye at KU, and then we'll ask Gerald how that's going to go in Wichita. My understanding is that we'll get these doses shipped to us, and then it's up to us to start putting them into the populations, or offering to the populations that are highest risk. The first population is healthcare workers, and then the second, and then right on the heels of that are the most vulnerable patients, and then it goes to first responders and others, and then it begins to move on down. And I think that's what I've read is a consistent message. And we think that we know we're a distribution hub for Pfizer. I suspect we will be for the Moderna one as well, because we have a lot of cold freezers. So I think we know that it'll come to us like that. But David, talk to us a little bit about the plans we've been working on for vaccination and for distribution.
So each state has been working with their emergency response teams or emergency management teams to develop what their statewide distribution protocol will be. And our team has been working nearly daily with KDHE on the Kansas plan. As Steve mentioned, the Pfizer vaccine, which requires cold storage, ultra cold storage, has some greater logistical challenges, say, than the Moderna vaccine, which does not require ultra cold storage. Both require 2 doses, so there's a logistical process to manage of when we set up your first vaccination appointment. There's a second appointment within a defined period after that. So that's a little bit more complicating on logistics. But to sort of talk a little bit about will everyone get the same vaccine, I think the answer to that we know is very clearly no. We will need really the totality of all of the effective vaccines to be able to most rapidly vaccinate the highest number of people. And I think it's I heard this morning, it's an important distinction, right? A vaccine does not save lives. Vaccination saves lives. And so we've got to get to the point where we can give the vaccine, the act of giving it to enough people in a way that generates long-lasting immunity. And the plan of starting with healthcare workers and moving to other populations still is in play. I think there is maybe just one little caveat to that. That's the plan, but there might be slight differences in the effectiveness of the vaccine. So the Moderna numbers that we mentioned this morning, they were great in that they actually gave us some data to work with. But when really pushed, the CEO said, well, actually, we don't know how effective it is because this was only the symptomatic patients. We don't know if this prevents infection. What we know is that it reduces the number of people that were symptomatic. This round of primary data early on didn't actually test everyone yet that had the vaccine or that was in the placebo group to see how many infections there were. And I only bring that up not because I think that takes away from this data at all, but it's an important point to say we don't want a vaccine for healthcare workers, for example, that prevents you from being symptomatic but still allow you to be infected and spread it to others. And so I don't know that that's the case here. We'll know over the course of time, but it's a really important distinction because, as you said, Steve, we don't really know enough to know the specific answers yet, and those are the sorts of things that we're paying attention to.
Yeah, we don't know about the Pfizer one either. We know that the Moderna one only has to be at -4 degrees centigrade instead of -80 or whatever it is. So that's an advantage. You can go into a normal freezer. Hawkeye, other thoughts that you have about the vaccine so far?
Yeah, I think it's good and make sure that people understand and are clear that there are multiple companies that make vaccines. So there are multiple companies that make influenza vaccine. There's a few different companies that make hepatitis B vaccine. So the fact that other companies are making vaccines is not a novel idea. This happens and has been happening for a lot and all the time. We have to understand that until we get the final data and information, it's going to be hard to make a distinction of should I get this vaccine versus that vaccine. And even after the initial rollout, there will be continual evaluation of the numbers and the significance of the vaccination, and that will go on. And so after the initial recommendations, those may be altered a little bit as we move further into this based on the most up-to-date available data. Right now, certainly the data that, or the numbers, we haven't really seen a lot of the data. But certainly it is, it's very, very encouraging
very
data.
Promising.
Because we did get a few more numbers than we did with the first one with the Pfizer. But hopefully they will all be as efficacious across the board and prevent illness, prevent severe illness, and also possibly even prevent actual infection and the ability to spread it to others, but we don't know that, and some of that information probably won't be released until after the initial rollout of the vaccines.
And Gerald, how about your sense as an infection disease physician and you're a public health officer for Sedgwick County as well?
I agree with what's been said. All the companies have commented on now's effectiveness. I think it's vitally important that companies also be very transparent about safety. We have to get a certain population number percentage before we're going to have herd immunity and get control of this pandemic. And there are at least discussions out there or suspicions that a number of people are very hesitant to take this vaccine based on what they know now because it's new. And they're concerned about past histories with vaccines that cause bad side effects or at least some side effects. So I think in addition to talking about effectiveness, they've got to assure us they have seen what they've seen at all in terms of side effects, because we've got to convince the population that this is a safe vaccine. You really should take it.
And Gerald, let's pivot a little to that. So to follow that second question, what are indoor sports? What's the story for that in Wichita now?
Well, as I understand it, school sports are under the control of the school systems. But for private sports, we have indicated that they can occur, but they can only have two guests per athlete to hopefully restrict the audience, restrict the kind of people sitting together up there, and we can spread people out in the stadium. We are also trying to put restrictions on our health clubs and our fitness centers in terms of keeping the place as clean as possible and being very attentive to the dressing facilities and all that. So, as you know, this is always a tension between the businesses and what we think is best for the public health and the economy. And so it's a very dicey discussion we have to try and keep the economy going. People want access to fitness facilities. I know it's a little different than what you were talking about in sporting events, but they want access to that for their health, and so we got to acknowledge that. So we're trying to be as open and considering all sides on the restrictions we're putting in.
Yeah, I think we're all trying to do that. Do you think we're going to be successful, or do we think we're going to end up having to shut down? Thoughts?
Well, maybe
that's the hard question, Gerald. Don't worry, I'm going to answer it too. I'm not only going to just ask you, I'm going to ask Wild as well.
Well, I think from purely a health point of view, I know what the answer would be. But on the other hand, people paying out of job, not being able to pay their rent or their mortgage, that's unhealthy too. So I get that. So it's a very delicate balance between the two.
It is. I think it's going to come down to whether or not we can take care of patients in hospitals. If we can't take care of people because there's too many, I don't know what choices we'll have. David and Dana, what are your thoughts?
Well,
you can't just look at each other. Somebody's got to answer it.
I think
That wasn't fun.
it's a tough question. I think if we continue to see the pattern of infections and hospitalizations that we're on, and there really is no meaningful change in public behavior, we're likely to end up in a situation where we don't have much choice. I'm not convinced that we're there yet. I'm hopeful that we'll do things as a community that help keep us from getting there. But I think realistically, I think we've seen in a number of places that at some point that is really the only option you're left with, and I hope we don't get there.
Hawk?
Yeah, I agree. I mean, nobody wants it. We have the optimal public health and medical advice, and that's to stop the spread of the disease. And then we have keeping the economy open in the optimal sense. What is the meeting point in between those two? What is the realistic goal? What can actually be done? Because we know that people continue to have to work, put food on the table, pay their mortgages and rents. So I think it's a matter of taking all these details and trying to assimilate them together to come to the best option. But right now, even if you get takeout from a restaurant, if you go back home to 8, 10, 15 people in your household who are not normally there for a get-together, that's where the spread is. It's not because you got takeout from a restaurant either. So it goes back to that individual responsibility.
I'll tell you, our public officials have a hard job, and we need to make sure we appreciate them, because these are, we criticize, we complain, we talk about how divided we are, but at the end of the day, it's hard to be a public official, and right now this is really hard, I think, on elected officials who are trying to balance all these competing goods. Here's what we know we can bend the curve without having to do draconian things, but if we don't, and we're overwhelmed, we can't take care of people, I don't know, that's going to be a tough position not to take stronger restrictions. So other questions from reporters, and then if not, we'll go to the community. All right, Jill, I'm not hearing any. I know Dr. Wild may have to fly for a minute, but we can keep going a little while. We're just getting to our community questions. So.
Yes, and they are really flooding us with some excellent questions this morning. So, and sometimes they are overlapping. So I'm going to group some of them when I can. First grouping is, what are the demographics of our patients that are currently with us, and including comorbidities, ages, and are they metro or smaller community patients?
Yeah, you bet. Hawkeye and Wild, what's the story there?
Yeah, well, so, I get this question a lot, and we do have a little demographics comparison slide I think we can throw up. There we go. I've done a couple of times a comparison between, say, the current period and maybe a previous couple of months. Today I just grabbed everything that we've had. So the overall category here is the total number from March 7th through now. And then the October-November is data through the 14th, so the first 2 weeks of November, so a 6-week period there. And so you can see the number of hospitalizations over time, the average age. We'll work through each of these. The percent of those that are hospitalized with no chronic disease, the percent of the COVID patients that are hospitalized from the Kansas City metropolitan area, the number of deaths, the in-hospital death rate, and then the average age. And I want to start at the very top maybe with a little bit of commentary. So 395 hospitalizations in a 6-week period. That's actually a third, 33% of all of our hospitalizations since March have happened in the last 6 weeks in Kansas City in our hospital here. And just for perspective, that's 18% of the weeks since the beginning of the pandemic, creating 33% of the admissions. And so anyone who is trying to get a grasp on, is it worse now than it was before, I think that tells you right, absolutely, without a doubt. Then the rest of the numbers sort of show a little bit of variation one way or another. Some of them don't mean much. I don't think there's a meaningful difference in the average age of the hospitalized patient currently being 57, and for overall the whole pandemic being 55. We do continue to see this trend. So in the first 6 weeks or in the last 6 weeks, we see a greater percentage than the rest of the pandemic of patients being healthy, having no chronic disease when they need hospitalization. We've talked a little bit about the slight shift of patients here that are hospitalized that are from outside the metro. So overall, it's about 80% of the patients are from Kansas City. The last 6 weeks, it's right at 70%. So a little shift, and we know that, I think, in the number of calls, as Dr. Mins has mentioned, coming from rural areas or even out of state where things might be a little bit worse or had been worse earlier than they were here. You can see the number of deaths, and that actually our death rate for hospitalizations continues to decline. Over time, we have better treatments. We are seeing people come to the hospital a little bit earlier, maybe. We have some outpatient options now with a monoclonal antibody therapy. We just know more. And so I think we would anticipate that the mortality rate would decrease. And then you actually see that the average age of those that don't survive has decreased slightly. Whether that's significant or not, I'm not sure. We'll see over time. But that gives you, I think, Jill, an answer to most of the demographic questions, or the ones that we get frequently, at least.
All right, Suzanne.
Yeah, those are. And hey, before you do that, Carol, is the data the same down in Wichita? Does it look similar to that?
Yeah, I think they're real similar. The number of Wichita metro versus outside kind of varies as our hospitals get full, and we can't admit people from the rural areas. Obviously, it's going to be mainly our metro people. So that number shifts based on how many beds we have.
Yeah, and I think that's a concern. I think there's this underlying feeling, gosh, if you're really healthy, you're not going to get sick enough. And I think, David, your data, 20% have no chronic conditions. I mean, I think that's really important. We all need to hear that, especially when you remember that the definition of a chronic condition is really loose, meaning that, high blood pressure, or being a little overweight, or having some mild diabetes counts. So very common problems can be called a chronic condition.
Yep. Yes, and you're exactly right. Those are exactly the sorts of things that we include in chronic conditions. And there are, of course, things like cancer or heart failure in there as well. But yes, high blood pressure, hyperlipidemia, diabetes, mild even in their forms, but diagnoses that you come into the hospital with do count in that chronic condition. So these are really people that are either very, very healthy, or maybe there are a few in that population that just have not sought medical care and might have some degree of underlying disease, but not significant enough that they've needed to see the doctor for it regularly. Either way, healthy people.
Yeah, we are all at risk, and that's the message, right? We are all at risk. Okay, Jill, next question.
Michael is a little bit confused and wants clarity around how do hospital workers get exposed and how do they get sick? If we know what we're supposed to be doing, how are we getting sick?
Yeah, we do good contact tracing, so we know it's not coming from inside the hospital, but we're all members of the community, and you're right. We do preach that, and we would hope that everybody leaves here and goes home and does all the right things, but sometimes that's a challenge, and many of our folks get out into the community, and they act like folks in the community, and that's the data we're seeing. Hawkeye?
Yeah, absolutely. We know that we've had groups who get together outside of the community, either for a celebration, a short trip, all things of that nature, which have led back to contact tracing and showing, well, this is where you got it because of the things that were happening within the community.
How many people are out today, David, do we know, for our staff?
Yesterday, I saw numbers that we were still right around 400 total who are out because they are positive or because they have a test pending. And so we'll get those numbers updated today with results from testing that was done over the weekend. That will move them a little bit. But no doubt we have continued to see an increase in the number of patients that are that are symptomatic and need testing, and also in the percentage of those that are symptomatic that are testing positive. And it's all community spread.
Yeah. And Gerald, how about in Wichita? Do you know what % of staff are out?
I don't know the percent, although I know it's been a struggle for the hospitals because they're so busy. Any loss of employees is really serious. I might add, in terms of our employees, yes, some of them have gotten it from activities outside the hospital that probably in retrospect they shouldn't be doing. But I also will tell you, we've had a number who've gotten it from their spouse who is not a healthcare worker. And I can tell you, if you get it and you have a significant other in your house, it's very likely the significant other is going to get it. And so you need to keep in mind that those other close to you are going to pay the price of your lack of responsibility.
Yeah, and I think kids, too, are bringing, well, that's one thing we know. The number of our folks have gotten sick when their kids from school got it and they brought it home. And, I mean, it's just tough when you're a parent or a spouse to deal with, not be with folks. So, Jill?
where are all the healthcare workers that, and why aren't they coming in to help hospitals in the Midwest? She's like, we went to New York, we went to all these different places. Why aren't people coming to help us?
Yeah, that's a great question. There was a story over the weekend about some folks from Tulane coming up to research at HCA. It's like one HCA hospital with another, and that's right good. And Gerald, you may know that if Wesley's done that as an HCA or via Christie. But this is a different time. The last time when the biggest surge hit in the spring, there were only a few places really on surge. So it was easy for the rest of the country to go to New York or to Seattle or what have you. Everywhere is on fire. Right? The entire Midwest, communities all across, and it's spreading more and more. And there's another surge now in Pennsylvania and New York and out west, and Seattle's experiencing it again. I think the narrative is going to be this. There's no one to help because we're all getting hit. That's what makes this the really precarious situation we were in before, much worse than we were in April, much worse. And the answer is, instead of looking elsewhere for help, look at yourself. You can help. And you can help if you follow the rules of infection control and wear a darn mask and stay separate and keep your bubble small. That's what's going to help us. We can bend the curve in 2 weeks if people will just do those things. Without that, I don't know where we're going to find folks to help because that's going on across the country. Hawk, or what, David, other thoughts that you have around that?
No, I agree with that. Exactly. We have had a lot of people who were very giving and went to those other hard-hit areas and those hard-hit cities. But I think, just as you said, every area is getting hit, whether it's urban or rural. I don't think there's a lot of excess workforce to go around because of that.
Yeah, same answers. Everywhere is struggling. We've had conversations with hospitals across the state of Kansas, for example, in the last week or two, asking if we have any options for staff, nursing staff specifically, to be able to come in to help. And I think the reality is that because everyone else is struggling the exact same way, and because more temporary or travel staff are also infected. I mean, it's just hard. Realistically, there aren't great resources to call upon. And I think the point that we are going to have to tackle this on our own, as much as that may be hard to hear because we did rush to the aid of other people or other communities, I think we are really at the point where we have to plan to tackle this on our own. And that means both in the sense of staffing and also, Steve, as you mentioned, our own personal behaviors.
Yeah. Gerald?
Ascension via Christie had teams of nurses going out to help other hospitals earlier this year, and I tell you now it's all hands on deck. And they are actually making calls to other Ascension-based hospitals asking if they have anybody to send. And they're all saying we need everybody here.
Jill, one more question.
Stephanie and Katie want to know, they live in different school districts, different sides of the state line, and schools are either decreasing down to 7 days after known exposure for quarantine, or they are eliminating it, saying that kids are wearing masks, so it's okay. And she wants to know, how does she stay safe?
Gerald, what do you think about that plan, and final thoughts that you might have from today?
Steve, somebody was at my door and I had to go see who it was. I missed the question. I'm sorry.
What do you think about schools shortening the quarantine or eliminating it altogether for known exposures?
I would be I'd be hesitant to shorten anything right now. I think we've got to hunker down, not get more lax.
Yeah, I agree. I think that's, we're trying to cut the corners at a time when the things are worse is tough, even if that means you have to scale back in person, I'm afraid. So final thoughts today, Gerald?
Again, I think we have to, part of our problem is communications. We've got to figure out how to communicate better. That the solution to this problem is through communicating and convincing people that they all got to band together and help out. I'm not, unfortunately, don't have a lot of background in that, but we need our experts in communication, as through what you're doing this morning is an example of that. But it's got to be more widespread. We got to reach out to more people and convince them that this This is only going to be stopped if we all get on the same team.
So true. David, are you still here? Final thoughts?
Yeah, so I'll echo a little bit of Dr. Minns. I think, there continue to be questions. Is this real? Is this different from the flu? I got that question from a group of elected officials last week. Is this really any different from a bad flu season? And my answer was easy. That's one of the easier questions that I've been asked lately. We never have 2 ICUs or 3 ICUs full of intubated influenza patients. Even in the worst of the years, H1N1, for example, wasn't like this. This is not the flu. So I think those messages getting out, how we communicate them, are important. And then I would actually then say to everyone watching, I know we've talked at length about the things that you can do and about remaining vigilant. And I would actually implore you now to take another step and say it is now time for each of us individually to be more aggressive in how we follow the rules of infection prevention and control, more aggressive in how we pare down our bubble size. We've talked about the risk of the holidays coming up. I think it's even greater today than it was when we started having those conversations 2 or 3 weeks ago. And so be more aggressive with all of those things. Always wear your mask. If you are outside of your home, wear your mask. If you come into contact with anyone, indoors, outdoors, close or not. If you're at all symptomatic, arrange to be tested. Stay away from others if you have any symptoms. All those things that we keep talking about, but really be much more aggressive with those in your own personal life.
Huck.
Yeah, I would just echo everything that has been said already. I would just like to thank Dr. Minns. Him and Dr. Tom Moore in Wichita were essential for me when I was a little med student in Wichita, so in getting into infectious disease, so thank you. And it all boils down to personal behavior and doing the right things within your bubble and really being concerned about letting other people into your bubble right now, because we don't want to have increased restrictions and the same things happen that have happened in other places. So continue to try and think about what is the right thing to do and do it.
That's right. We made our mark in this program by not flapjacking. We don't flap our arms and jack with the truth. We try and be calm and tell you the truth. And today we did. This is the truth. I like to recite that first part of the preamble of the Constitution. We, the people of the United States, in order to form a more perfect union, establish justice, provide for the common defense, promote the general welfare. I mean, those things say not that we are a nation that is a collection of individuals. It says we're a nation who come together over a common belief. That belief is that we have to take care of each other. When my children were young, we would, you try and talk about how do you get certain morals and stuff established into your kids or whatever. And I remember one time my oldest child and I were having a bit of a disagreement around something, not that I ever wanted to step out or anything. And I looked at her and I said, kid, this is a character issue. I say that to everybody now. This is a character issue. We're going to take care of each other. Or are we going to say that our individual decision to not wear a mask and to go out to party and do different things trumps we the people? Right? Does it trump it? And if it does, at what cost? How many people have to die and how many people have to suffer and how many people have to have long-term injuries before we are finally convinced that we the people is a character issue? We'll be back tomorrow. We have some great guests that are here with us. KDHE Secretary Lee Norman joins us, along with the KDHE Director of the Bureau of Disease and Prevention, Phil Griffin. We're going to talk more about those efforts to slow the infection spread, as well as an update plan for a vaccine. I think I will not be here tomorrow. That will be Dr. Wild, Dr. Hawkeye. I will be doing some other things related to studying in boards and stuff like that you have to do out there in the world. As we leave today, we're going to finish up with some of the thoughts from last week. I talked about being an ICU physician for so many years and the 5 rules. And you know what? Those 5 rules are still true. And they all harken back to the basics. In a time of a pandemic, remember, The rules of infection control go with you wherever you go. And there's still no place like home. We'll see you soon. 5 rules. Rule number 1, we the people. We're in it together. It's not either one. Rule number 2, do the right thing. Wear your mask, keep the distance. Rule number 3, be the bridge. The bridge to the better day, and it's not that far away. You can do this. Ask questions, seek answers. Always ask us questions. We're going to be here. Please ask those questions. We'll try to answer them in a calm and honest and straightforward way. And that's what we need to do. And it's fair to ask questions about vaccinations and masks, but then you have to believe the answers from science. And then rule number 5, those who laugh last. It's important for you to continue to take care of yourself for your mental well-being and your emotional health in this really difficult time. Those 5 rules. But it starts with we the people.